Hello, everyone, and welcome to the Rehab Act at 50 Years, Part 1, Origins, Evolutions, and Current Day. My name is Bailey Reeves, and I will be providing technical assistance during the meeting. Closed captioning and ASL interpreting are being provided. To view the interpreter, you may also set your screen to gallery view. You can switch between gallery and speaker view in the upper right-hand corner of your Zoom window. To view the captioning, click on the CC icon at the bottom of your Zoom window. All attendee microphones have been muted to avoid background noise. We ask that you keep off your webcam to allow the attendees to easily view the interpreter. During the Q&A session, please use the chat box to ask a question. Questions will be read aloud by the session moderator for the panelists to answer. This meeting is being recorded, and the recording will be made available for future viewing. It is now my pleasure to turn it over to Allison Barkoff, Senior Official performing the duties of the Administrator and the Assistant Secretary for Aging at the Administration of Community Living. Allison, please proceed.
Hi, thank you so much for joining us today to celebrate the 50th anniversary of the Rehabilitation Act. Let me start with a brief visual description. I'm a middle-aged white woman with curly brown hair, wearing a black suit and a white and black blouse with a blue background and the ACL logo. So thank you for joining us today. Many of us gathered yesterday in person and virtually in a convening by the White House to really recognize the importance of the Rehabilitation Act. And I was really excited to facilitate part of the program focused on the independent living movement and independent living programs. And I am excited that we will be continuing that conversation today. The Rehabilitation Act is just momentous and historical for the disability rights community. And the Rehab Act and the independent living movement are so intertwined. It was advocacy by the disability rights community that led to the Rehabilitation Act. Disabled people and their allies fought and advocated to get President Nixon to first sign the act on September 26, 1973, 50 years ago plus a day. And signing the act, we know, is not enough because statutes without enforcement doesn't mean anything. And for 4 years, the disability community engaged in nationwide advocacy and historic, peaceful occupation of a federal building by disabled people. And this really spurred incredible leaders like Judy Heumann, who's known as the mother of the disability rights movement, and leaders like Ed Roberts. And it really created the independent living movement. And it is because of that advocacy that the secretary of what was the agency then, before the U.S. Department of Health and Human Services, it was then called the Health, Education, and Welfare Agency, finally signed Section 504 regulations. We're going to hear a lot about that today. We're going to see a little bit about that. And for people who want to learn more, there was an incredible documentary that was Academy Award nominated called Crip Camp that just shows the incredible power of the disability community. We cannot overstate the importance of Section 504 of the Rehab Act. That was the first disability rights legislation. It opened up doors to so many federal programs, to transportation, to housing, to healthcare, and it is a law that continues to be powerful, continues to be important. And again, we'll hear a little bit today about what we are doing across the federal government to invigorate that civil rights statute in the Rehab Act. And it was an incredibly powerful stepping stone and foundation for the Americans with Disabilities Act. But a lot of people also don't know that the Rehab Act created and funded really important programs, including the independent living programs that are administered and funded by the Administration for Community Living. And one thing we're going to hear about today is what's so unique, what is so important about the independent living programs and the independent living movement is how they have changed the paradigm of disability. It's about disability power. It's about empowering people with disabilities. It's about disabled people controlling their own lives. And it is a real move away from the medical model of disability. So without further ado, I am really, really excited for our panel today who's going to dig in to more of these issues. Let me start. And I have these people, I could probably spend the entire webinar listing all of their career accomplishments because they are truly extraordinary. I really encourage you to read their full bios online, but I'll just say a few words about each of them. First, we have John Wodach, who is truly a disability rights pioneer who has been instrumental in crafting federal disability rights laws and enforcing those laws. He firsthand, literally probably with pen and paper at the point before computers, played a hand in creating and implementing the Section 504 regulations and was a primary architect of the Americans with Disabilities Act. And I am so proud to say he is a collaborator as we are working to implement and update Section 504 regs for the first time since 1977. So, John, thank you for being with us. Next, I'd like to introduce Mary Lou Breslin. Again, another pioneer in the disability rights world. She has been engaged in disability rights law and policy for over 35 years. In 1979, she co-founded the Disability Rights Education and Defense Fund, or DREDF, a leading national civil rights law and policy center, and presently serves as the senior advisor with DREDF. Next, I want to introduce Colleen Starkloff. Again, we have truly people who have been part of this movement for decades, who has been working in the field of disability rights since 1973, when her husband, Max Starkloff, founded Paraquad, one of the nation's first federally funded centers for independent living. And in 2003, Max, Colleen, and their longtime friend, David Newberger, founded the Starkloff Disability Institute. And last but certainly not least is my friend and colleague, Theo Brady, the executive director of the National Council on Independent Living, or NCIL. He has been part of this movement a long time and was the CEO of a Center for Independent Living in Pennsylvania for over 30 years. And then finally, we are really excited to have an incredible moderator for today's panel. Lex Frieden. Lex is a professor of biomedical informatics and rehabilitation at the University of Texas Health Science Center at Houston. He has served as a chairperson of the National Council on Disability, president of Rehabilitation International, and chairperson of the American Association of People with Disabilities. And he is recognized as one of the founders of the independent living movement in the early 1970s and was instrumental in conceiving and drafting the Americans with Disabilities Act. So Lex, I will turn it over to you for an exciting panel. And thank you again to everyone who's joining us.
Allison, thank you. And it's a privilege and an honor for me to be here with all of you today. We do have an outstanding panel, and I want to move it to our panel and also let you all know that we have reserved time for Q&A, for discussion with the audience. So please make note of any questions that you have and use the chat as we continue on here. I'd like to take the personal privilege to describe a couple of things that happened during the early days. The Rehabilitation Act of 1973 evolved during a time of social unrest in the United States. You have to sort of frame this as follow-up to the Vietnam War and a time during which people were active in California. Hippieville was set up in San Francisco. There were all kinds of activism efforts to end the war in Vietnam. The president was assassinated during this time period. You had women who were marching for equal pay and equal rights. And you had the follow-up to the Civil Rights Act. of 1964 and the rollout from all of that. So in the middle of this discussion, those of us with disabilities in the early 1970s began to see how we were not treated equally. I, for example, was told I couldn't go to a university because I used a wheelchair. And many other people had the same kind of confrontations with universities and public service providers, governments, and everything else. So we were a little frustrated, and we began to communicate with our legislators. My senator from Oklahoma wrote me a letter in 1972 saying we're trying to right the wrongs. We understand the frustration you must have as a person with a disability, and we're working on a law that would be called the Rehabilitation Act. Interestingly enough, and most people don't realize this, President Nixon vetoed the Rehabilitation Act not once, but twice. And the reason he did so was because it included a section on independent living. The legislation included in both accounts independent living funding that would have gone to the states and enabled us to really get rolling with the independent living center movement. But those were vetoed, and the law that finally passed included a section, Title V, that nobody really understood the meaning of, except for those of us who were a little bit receptive to the notion that this particular section might give us an opportunity to assert our rights. In fact, a woman named Jenny Laurie, in a publication that only a few people read, put on the face of her magazine, the Rehabilitation Act is a declaration of independence for people with disabilities. Shortly after that, independent living centers started in a few cities. Houston, Berkeley had a center going. We had a center in Boston, another one in Charlotte, North Carolina. There was a center in Michigan, and just sprinkled around the country, a few centers that sort of sprang up because those of us with disabilities were talking with one another by telephone. We didn't have the benefit of internet, but we used the snail mail, and we were able to communicate. The progress that we made beginning in 1973 cannot be overstated. The 78 amendments to the act included, for the first time, money for the federal government to actually sponsor centers for independent living. The 83 amendments included the provision that enabled us to use the National Council on Disability to frame the Americans with Disabilities Act. And of course, that law was signed and passed. And in 1990, we finally did have our Independence Act. So with that, let me ask John Wodash to begin our panel discussion. I think, John, we first met in 1975 when you were working on regs at the Department of Justice for Section 503. And I was invited to come and be among the individuals who you consulted with. John?
Thanks, and thank you for having me today in this discussion. I'm delighted to be with such an esteemed group of people. Let me go back to where Lex was, because I think it's important to see where we were in the 70s. And it was not only a time of unrest and intellectual development, but for people with disabilities, it was a life of isolation, stigma, and stereotyping. Little accessible housing, very few accessible buildings, very few even accessible public restrooms. Children with disabilities, if they were educated at all, were in inferior separate institutions and schools. Little accessible public transportation, restrictive employment opportunities. You get the picture of what life was like for people with disabilities and why there was a need for Section 504 in the Rehabilitation Act. I was given the job, the law was enacted. I was given a job. I was an attorney, a civil rights attorney, doing school desegregation, sex discrimination. at HEW and was given the job to, okay, what is this? Write a regulation, do something. And it began the process. And our process began by reaching out to people with disabilities around the country, including Lex, including many others, talking to people. What does this mean to you? You know, what is discrimination? How can it be remedied? And it was a very important period of time. I got to, it was interesting to deal with the disability community at the time because it wasn't a community. It was a siloed community. People with wheelchair users never really spoke a lot to people who were blind because of the isolation in our society. But we got together, and the regulation that we developed really was based on the lived experiences of people with disabilities. I'll give you one example, and I think the heart and the most important example. What is discrimination? How do you look at that? And so we talked to people across a wide spectrum, and we learned basically that people with disabilities were an incredibly rich resource. They not only understood their existence, they understood the barriers that they were confronting and the solutions that they had to those. And the important thing that we came up with was, how do you look at discrimination? There were people who said, oh, discrimination, you just have to treat everyone the same. That became clear as not, if that was the answer, then 504 would not bring about a fundamental change in American society, which we saw it as. And so we looked at it and said that discrimination would include the failure to take positive action when dealing with barriers. I think it makes common sense to us now, but at that point, it was a revolutionary idea that to say non-discrimination would mean you would have to do reasonable accommodation to someone. You would have to, the act of having just stairs and an entrance to a building is discrimination. Not having a sign language interpreter at a doctor's office, that is discrimination. Having only textbooks for elementary and secondary schools or colleges is discrimination. That whole idea that was, I think, at the heart of one of the most important things in Section 504 that we got from the community of people with disabilities and put it into the regulation was the heart of it. And I think what we learned in that process at first was how siloed the disability community was, but it was also the beginning of experiences across disability for people with disabilities, and an understanding that there were incredible similarities because of the barriers that society had placed in the way of people with disabilities. And so I think that the key thing in terms of the first regulation and looking at what discrimination is was coming to grips with that very broad concept, which you can call reasonable accommodation or reasonable modification of policies. It permeates Section 504 and became the basis for the ADA and for the UN Treaty on the rights of people with disabilities across the world. And so it was people with disabilities and their experiences that formed the heart of what is non-discrimination, and what you have to do to overcome discrimination became part of the regulation.
John, we'll come back to you in a few minutes. If you don't mind, we'll move along to now. And Mary Lou, you were at the center of our advocacy as we worked really to get the attention of the federal government when it came to getting the regulation actually in the rule signed. I mean, many of us, when the act passed, thought we were on board, all would be well. But in fact, what we learned when we filed complaints was there were no rules. So nothing happened. Mary Lou, how did that come about?
Well, thank you, Lex, and thanks to all the organizers of this program today. It's really an honor to be here. So as previous speakers have mentioned, the regulations interpreting and giving guidance to the entities that were covered by the statute who were required to comply. They were, of course, incredibly hard won by the disability community. And as I think some of you will know, after the years of delays that occurred between the time the statute was enacted in 1973 and the regulations were finally passed in 1977, finally signed in 1977, disability organizations around the country organized protests and sit-ins, specifically 1977, calling for the regs to be signed. So this was a function of an extraordinary amount of frustration and anger, really, at the agencies, particularly the HEW, not John, not other folks within the agencies who were calling for changes in the regulation that John had written that would have reduced its impact, and that included references to separate but equal facilities. For example, one of the changes that was being proposed from the original regulation that had been drafted was that folks would be required to go to, for example, in a higher education situation, that a state university system would be required to make one school accessible and not others. So you can imagine the incredible amount of frustration and anger that those kinds of proposals raised. So the result of this anger was, at least in San Francisco, a sit-in in the San Francisco Federal Building of around 200 people, disabled people, who occupied the building for nearly a month, demanding that the Carter administration sign the regulations. They've been repeatedly delayed as these proposals to reduce the scope were floated. So I think one of the most memorable moments of the sit-in for me and for others came when Congressman George Miller and Congressman Philip Burton were there on behalf of the U.S. House Education and Labor Committee. They held an ad hoc hearing in the building to hear testimony from over 40 disability activists on the fourth floor, which was the floor the demonstrators were occupying. And I can very clearly remember this particular event because everyone crowded into this room, and Mayor Moscone attended, other politicians attended, the press was there. This was quite an event that had been organized by protesters who hadn't had a bath in several weeks. So you'll be hearing some of the testimony in excerpts from a video entitled The Power of 504 that we'll be showing in just a minute. The video came about as a result of the disability community in California planning a celebration for the 20th anniversary of the signing of the regulations. So just let me give you a little bit of context before we show the video. At one point during the hearing, the HEW representative, who will remain nameless, had been coming under quite a bit of heat from the people who were testifying because of his proposal that separate but equal was under consideration. So he stood up and he left the hearing room, walked down the hallway, locked himself in a nearby office, whereupon Congressman Phil Burton leapt up and ran after him and kicked on the door and insisted that he come out. This would give you a sense of the tone and the heightened sort of passion in the room for the issues that were being discussed. So we're going to be showing you a quick video. These are excerpts from a longer video that trace the origination of the sit-in and go through to the period of time where several of the demonstrators had gone to Washington to meet with federal officials and with the president in the hope that they could actually achieve the signing of the regulations. So I would just want to make note here that the language you're going to be hearing in the video around disability is outmoded, but it represents what was typically used at the time. So can we just show the video now?
We're down to the bottom line, down to the basic issue here. Are we going to perpetuate segregation in our society. We're one of the largest minorities in this country. I looked at the 18 points that HEW put out this morning. I have never seen a better blueprint for segregation. These kinds of issues, the issue of civil rights, of human rights, are not one issues that people with disabilities can compromise any further.
If they had to choose the most important part of these regulations to eliminate and to reconsider, they chose them. So I resent the fact that they say we're in fundamental agreement. We're not in fundamental agreement. We're in fundamental disagreement.
Whether there was a Section 504, whether there was a PL 94-142, there was a Brown versus Board of Education. The harassment, the lack of equity that has been provided for disabled individuals, and that now is even being discussed by the administration, is so intolerable that I can't quite put it into words. I can tell you that every time you raise issues of separate but equal, the outrage of disabled individuals across this country is going to continue. It is going to be ignited. There will be more takeovers of buildings until finally maybe you begin to understand our position. We will no longer allow the government to oppress disabled individuals. We want the law enforced. We want no more segregation. We will accept no more discussion of segregation. And I would appreciate it if you would stop shaking your head in agreement when I don't think you understand what we are talking about.
The group this afternoon put the final touches on their next plan of action. They're taking their protest to the source. 14 handicapped demonstrators and 8 attendants will fly tomorrow to Washington, where they hope to see President Carter himself, or at least tell HEW Secretary Joseph Califano themselves how they feel.
It was sweltering hot, but they went to HEW anyway, staying in the streets when the curbs stopped them. They were trying to force a meeting with Califano after he had canceled one scheduled earlier, but they were blocked.
I felt like I was being excluded from a building that I pay taxes to keep open, and I am absolutely mortified that President Carter is allowing this to go on. His open policy certainly is not very open, and to have these big 6-foot, 7-foot cops standing there with people my size is the most ludicrous thing that I have ever been involved in.
Back in Washington today, more than 100 people marched in front of the White House. The demonstrators would be content if Carter would only put pressure on the HEW director, Califano, to sign the Civil Rights Bill guaranteeing the rights of handicapped people, but it doesn't look as if Carter will even do that. It looks even less promising for Carter to see the demonstrators personally, even though they've traveled there from San Francisco for that very purpose.
It's a beautiful video, and it reminds us all, those of us who were there at least, of some inspiring moments. Among the characters in that video, you saw in the beginning Ed Roberts, you saw Judy Heumann speaking, my friend Hale Zukas, one of the great disability advocates, was pictured in that video, and Eunice Fiorito, who was a blind individual who ran the Office on Disability in the city of New York and who was the president of the American Coalition of Citizens with Disabilities, was also pictured in the video. A lot of our heroes there. Mary Lou, thank you so much for sharing the video and sharing those memories with us. Moving forward, clearly the disability rights movement was fueled by Section 504, but the Independent Living Center movement was also fueled. At the same time we had a disability rights movement, we had an independent living movement. They were sort of conjoined. And many of those of us who were focused on services got engaged in independent living. Among those were Max Starkloff from St. Louis, and Colleen. We miss Max, but we're glad to have you here with us today. Can you share some of your memories?
Yeah, thanks, Lex. I share everybody's comments about how much of an honor it is for us to be celebrating 50 years of the of Section 504 of the Rehab Act. And I got to say, as a cancer survivor, I'm just glad I'm here. But anyway, I want to point out that there were a lot of advocacy organizations working in states all across the nation in the early 70s, and some had little or no funding for their activities, but they worked on things like housing and transportation and healthcare and curb cuts and a lot of issues that were pertinent to their local areas. But many people with the most significant disabilities were relegated to nursing homes for lack of accessible housing, attendance, community access, and really attitudes toward living with disability itself. That's on the part of disabled people, but also non-disabled people didn't know what their resources or rights or options were. And their rights, frankly, were pretty non-existent before 504. Well, they were non-existent before 504. So thanks, John. When the Rehab Act was enacted, 504 focused on eliminating discrimination toward people with disabilities. And as John said, they had to figure out what that looked like. And thank goodness disabled people said, here's how it feels and here's what it is. But what happened was then the 504 trainings were held nationwide. And so they went all across the country, consultants went all across the country, and we're training people with disabilities. First of all, really what were the intricacies of 504 and the Rehab Act and the law, and what you could do as an advocate and what you were entitled to do. And that, I got to tell you, that was very empowering. It was huge. And one example that I can talk about, because we were entrenched in it all across the country, was the bus issue. You know, a lot of disabled people didn't have cars, didn't have jobs, didn't have access to public transportation, certainly, because there were no lifts on buses unless they were special school district buses that had lifts on them. So 504 said that if you get public money, you can't discriminate against people with disabilities. And most of the funding for, like in our case in St. Louis, 80% of the funds came from the federal government to purchase new buses. And St. Louis was about to buy new buses. And the first 157 buses of the new fleet had lifts on them, but not without a fight. We went down to a meeting of the Board of Commissioners for the Bi-State Bus Company, and we packed it. You couldn't get in or out of that room because there were so many people in wheelchairs in there. I literally, had there been a fire, would have been a sad situation because we literally packed that room. But it was important because we began to feel our power. 504 gave us power. 504 has made colleges and universities and hospitals and museums and trains and housing, you know, publicly funded housing, accessible. And disabled people have the capacity to be trained now for America's workforce. So we get to advocate for things that we need to live independent lives in our community. And we believe that we have a right to have these things. And so 504 really did give us power. And back to Ed Roberts, he started out by making the campus at UC Berkeley accessible, and then went on to found the Center for Independent Living with Hale and another person. But that was the beginning of the concept of consumer-directed and consumer-controlled services. And the way they started that was by pulling their SSI checks and hiring students on campus to work as attendants, so they didn't have to live in the hospital's medical facility in order to get bathed and dressed and out of bed every day by nurses. That was a medical model of assistance for disabled people, and we really have rejected that model. And as Lex told you, he had a center in California, sorry, Lex, in Houston. But both centers were focused on creating services that would really empower disabled people to live independent lives and to see themselves as independent and to see themselves as having the capacity to control their own lives. But you did have to create resources because, as we've pointed out, there were not any requirements to have accessibility in places that were federally funded. You just, you could write a letter and it would go in the circular file. But we were looking at things like peer support and how important it was that people with disabilities were supporting each other to believe that they had power, that they had the capacity to live an independent life. You had to do advocacy, and you had to have information and referral and attendance search and registries. Those are some of the very early kinds of services that were being thought of by these centers. But when the Rehab Act was amended in '78 and Title VII funding was added, which, as Lex told you, was excluded initially, that enabled funding for the actual funding for the establishment of independent living centers. There were 10 that were funded with the first $2 million allocations, and $200,000 went to each center. And and Paraquad was one of them, the center that Max and I started in St. Louis. What happened was, in the law, it said that these centers had to be controlled and staffed by people with disabilities. I mean, who ever heard of that? But this was in the law. So, John, if you put it there, thanks. I didn't know you put it there, but thanks. This meant you had to have a board and staff of 51% majority people with disabilities. That was significant. Again, empowerment and power. I just want to point out that Max was quadriplegic and he was living in a nursing home when I met him, and he wanted out. And he had met Ed Roberts in California on a vacation that he took out there. And what Ed told him got him very excited. And that's why he came back. And what we did is we changed Paraquad from a housing-focused organization to an independent living-focused organization. So we asked the other 9 centers to come to St. Louis and to begin to have a conversation about what independent living would look like, because people were doing different things in different, wherever they were, they had based on their local needs. And we had to look at a higher order of what was needed by all people with disabilities. So that brought us to the realization that a cross-disability approach was important. You couldn't just work for people in wheelchairs. You had to think about people who were deaf, who were blind, who had intellectual disabilities, who had mental health disabilities. There's strength in numbers, and we had to coalesce ourselves, and that made us do that. In the course of all of this, we built strong relationships among one another, and we decided that what we really needed was to advocate for continued funding for independent living centers, because that was only a $2 million allocation, and we needed to be sure there'd be more. So we decided to form a national organization. We named it the National Council on Independent Living, or NICL. And it's still very strong today, and it's gone on to support the establishment of centers. Theo can tell us how many there are now, because I've lost track. But it's been a realization of the power that we had as citizens to change the course of our lives, because we believed we had the right to do it. So I think it's important to also point out that 504 not only gave us power, but when 503 was finally enacted in 2014, the changes that had come about because of 504 requirements like higher education, like access to training programs, to colleges, to universities. It was so important that when 503 came out and said that if you're a federal contractor, you have to hire people with disabilities at 7% of your workforce, we were ready because of 504. So I think I just want to sort of sum up that because of the Rehab Act, hundreds of independent living centers exist all across the country, and frankly, they're spreading around the world. The realization of empowerment came to us. Consumer control and self-determination was defined by law. We had a cross-disability approach. The world was dramatically more open to people with disabilities. The regulations for 503 were finally enacted. Opportunities for employment were increased, and this paved the way for the ADA. And a change of attitudes on the part of disabled and non-disabled people toward disability has occurred. Now, we still have some people who are stick in the mud, some don't get it, but I think that's part of why we continue to exist.
Colleen, thank you so much for your thoughts. Before we move on to Theo, and this will make a nice transition, one thing I will point out about the Rehabilitation Act of 1973 that too often gets lost, and that is that the Rehabilitation Act actually sponsored employment training for people with disabilities. That money that was sent to the state rehabilitation agencies was significant, lots and lots of funds. And those monies were used early on because of rules that were in the law to help people with the most severe disabilities get training, education. It paid for a lot of education, university education. It helped people get through college by providing assistance to them, personal care assistance. There were a lot of significant aspects of the Rehabilitation Act that get lost in the discussion of disability rights and independent living that we need to keep in mind. Now, over the years, this has drifted away, and those state rehabilitation agencies still have to, according to the law, provide assistance with people with disabilities. But if you look at the disparities between the workforce of people with disabilities and those without, you can still see that we have not even begun to reach the advocacy that we ought to do as it relates to employment. Now, one of the keys to that in the community may be centers for independent living. Centers for independent living, as Theo will tell you, are seen by people with disabilities as an anchor for their own lives. And most of us look at centers as a place that will help us find housing and services. But I believe going forward, there are many more opportunities for centers to serve our community. Theo, with that, let me turn it over to you.
Thank you, Alex. Before I get into my part, let me say this. It does not escape me that I'm in the presence of some extraordinary people, right? This panel is amazing. As I sit here and I listen to some of the history, I am who I am because I watched and heard and listened to a lot of you all. And even when I watched the video, and I have shown that video many times as an adjunct professor, it has still affected me in a major way. So thank you all. Thank you all. I appreciate each and every last one of you all. As a person with a disability for a visual description, I'm a Black man, glasses, salt and pepper beard with a checkered shirt on, sitting in a wheelchair, a motorized wheelchair. It is amazing to me to look back and see what happened with the Rehab Act. It was a game changer. It really was. It started what we now have as an extraordinary network of centers for independent living all across the country, right? I said this yesterday, I'm gonna say it again. There's no other model in this world that demonstrate what we have here in the US, which is a network of centers for independent living run and operated by people with diverse disabilities. And it's one of those kept secrets that people still don't utilize the way they should, right? And it just amazed me how all of this came to happen. Right now, we have over 403 centers for independent living, 330 branch offices, and 56 state independent living councils, all representing people with all types of disabilities to improve access and equity, which is the pillar of what the Rehab Act was all about, right? And then we go on and we have used that IL network. I mean, it's amazing how many people with diverse disabilities are coming together and kicked off the not only the Rehab Act, but it led into the ADA, right? And we continue to fight for everybody want to weaken the ADA, and we continue to fight that battle. We will continue to do that, right? And then not only that, that network that we're talking about of people with diverse disabilities led to the ADA, it led to Olmstead, it led to Money Followed the Person, it led to the Affordable Care Act. But one of the things that I learned from Ed Roberts, Judah Human, Justin Dart, and a host of other people who was my personal mentors is that you can have laws on the book, but that doesn't mean that those laws will be enforced. And so that's what is the essence of the network of centers for independent living. These are people who hold others accountable. And we are still holding others accountable, right? Because we don't have that equal playing field that we so desperately want and so desperately talk about. We still have things that prevent us from doing the things that we want to do in life, right? And unfortunately, we fight the same things that you all are talking about here, right? And I struggle with it because I know it must be a better way. As a person with disability has lived for a long time, and I became what I am today, like I said earlier, because of who you all are. There got to be a better way for accessible, affordable transportation. It got to be. Got to be a better way for affordable housing. And now these are the things that we're working on and we're struggling with still today. Got to be a better way for accessible, equitable healthcare. Now, don't get me wrong, we're trending in the right direction right now with that designation of people with disabilities as a health disparity population. I'm so excited about that. I'm so excited about the 504 recommendations. And so we're trending in the right direction, but there got to be a better way for us to, as people with disability, to gain education without going in tremendous debt. There got to be a better way for us to move up the ladder, and this is the big one right here. Got to be a better way for us to move up the ladder to success without losing life-sustaining benefits. I think that's one of the biggest challenges that we got to fight as an IL network. All the restrictions are put on people with disabilities who are trying to earn income and maintain their health benefits. Got to be a better way to address the crisis of the lack of direct care workers who assist millions of people on a daily basis. And these are the things that sprung up from the Rehab Act. And when we gain that power, and we know we can change things because it's been done before, right? And so finally, I got to say this, it got to be a better way for us to exist in this world without ableism that makes society believe is that people with disabilities are better off dead than having a life worth living. And I think we can't escape the fact that when we watch that video, right, almost every word that was said in that video can be said today. And that amazes me. Although I know we have made a tremendous amount of progress, don't get me wrong. I know that, and I celebrate that each and every chance I get. But I got to be reminded of the fact that although we still have we have an ADA, we have money follow the person, we have the Affordable Care Act, we have Olmstead. Society still has an institutional bias, and it should be a community bias. And I thank Allison for all the work she's doing to change that. And I think we are, again, trending in the right direction, but it blows my mind that we're still institutionalizing people. So it got to be a better way.
Theo, thank you very much. Those were thoughtful comments that I think we can all resonate to and all agree with. Personally, I think the Centers for Independent Living, and glad that you're in the leadership position you're in today. I think the centers can help people in communities pull themselves out and put themselves forward. And I think that's one thing that we as a community have not done as well as we might, and that is to engage in public service, to be there when the appointments are made by public officials, to actually put ourselves out there running for public office. And I think we have many opportunities that lie before us. At this point, I'd like to turn to our participant audience and invite you all to put forward any questions you have. And I'm going to ask Allison if you would help us moderate these questions and give us the first question if we have one.
Hi, thanks, Lex. This is actually Erica. So one of the questions we had was, what advice, this is for the panel, do you wish someone had told you when you were a young activist?
Okay, thank you. Thank you, Erica. What advice you wish somebody had told you when you were a young advocate? Mary Lou, what's your answer to that one?
Well, actually, I don't think at the time we were aggressively working to get the 504 regulations signed into law, and thereafter sort of implement 504 and later the ADA. That if I think the best advice that somebody could have given me would have been, what are you trying to do? And do you really think you can do this? And how can you possibly change these things? This is being a little facetious, but I think that the advice would have been, don't be deterred from your course. That's I think advice that's resonated in the 1970s and resonates today. As Theo said, we have many challenges ahead. It's important to pause occasionally and look back at what we've accomplished and what changes we've wrought, which are really quite extraordinary. But the challenges ahead are quite stark as well. And I think the advice that I would have hoped someone would have given me would be, don't be deterred.
Theo, how about you?
I love this question because I get a chance to say it and hopefully someone hear it, right? When I was around probably 29 years old, I had an opportunity to be mentored by Ed Roberts. I had an opportunity to be mentored. I spent time with Justin Dart. And during that time, I didn't know that those individuals was going to go on and be in the history books and the extraordinary people that they were, right? And I was just doing my own little thing but so I say this, while you have an opportunity to be with individuals who are doing the work, listen to them a little bit more attentive. Because if I would have knew what I know now, I would have spent a little bit more time. I would have listened a little bit more attentively. I would have wrote some things down. I would have took more pictures. And I just would have appreciated that time being with those individuals. And so capture those moments right now. And while you have people that you respect and you know who those individuals are, listen a little bit more attentively.
Good advice. I would say, get engaged. Don't just look at and see it and complain about it, but do something about it. I mean, if there's a violation, file a complaint. Send a complaint to the Department of Justice. Send a complaint to the U.S. Attorney's Office. They will act. If you see something, say something. Don't just watch it go by and be angry about it, but take action. And people said that to me. Sometimes I ignored it, but I'm glad I took some action. And I think everybody ought to do that. And I do believe what I said a while ago. We need to engage in the political process. We shouldn't just wait and watch how the vote comes out. We should help to influence the vote. We should be out there joining campaigns, and we should strategically place ourselves in every campaign so that regardless of who wins, they're always on the disability issue on the right side. Let's go on. And Colleen, you want to add something?
Just briefly, yeah. I think it's important that people, especially younger people who maybe don't have access to the mentors, not be afraid to express your ideas for a potential solution to a problem. It might be a great new idea that nobody's thought of, but but even if it isn't, it's a way that you learn. And as Lex is saying, you get involved in the process and you begin to learn, but don't be afraid to dream big about what ideas could happen and to change the world. And the other thing is, if somebody tells you no, stop talking to them, go find somebody else. You can always find somebody else. That's Max and I were king and queen of that. If people said no, we thought, don't waste our time, go find, and you can always find somebody else who can be an ally.
All right. Okay, so we have another question.
Yes. So another question is, everybody wants to know what the new frontier is now. Like, where should people focus their efforts? Should it be employment, community living, education, funding? I think the advocates are wondering where their focus should be.
Yeah, well, it sort of depends on who you ask. And in fact, that's not a bad thing. All the issues that you raised are important issues. Clearly, the data, we do a lot of polling and do some surveys at ILRU. And what we learn from the community is many people are frustrated by the lack of accessible, affordable housing. Many people are frustrated by the lack of available, affordable attendant care services. Many people are frustrated because they can't get a fair hearing if they apply to get a job. Many people are frustrated because the transit system doesn't work the way they need it to or expect it to. So we all have these agendas, and it's really hard to break them down. I think what we need is a multifaceted movement that has a strategic direction where we are working together, all together, to reach all the outcomes that we can display. And I mentioned the American Association of People with Disabilities. That's an important organization that I believe has the potential to bring together the disability community, aimed at all of the targets that we talk about and that we're aware of. Theo, do you want to add anything to that?
Yes. I don't think we have accomplished what you just stated, Leth. We have not galvanized and come together as much as we should. Right. And I know for a fact that if we ever do that, and I think we learn from our past, if we ever get to the place where that one thing that we can do to bring us together, I think we'll be much better off. And I also think this, one of the greatest things that is hindering us right now is ableism. And it affects everything that we're working towards. And I believe education is the key. And I think we should do all that we can do to dispel many of these myths, stigma, and misconceptions about people with disabilities. We need to be visible and out there to do that.
Theo, you've mentioned ableism a couple of times. How would you define that for people who may be tuned in, but not tuned in to the differentiation of terminology?
Yeah, well, unfortunately, we have been socialized to believe a certain way about people with disabilities. Society have just taught us to and everywhere you turn have taught us to believe people with disabilities don't have much value. They don't contribute. We take more than we give, right? And we got to change that mindset. And unfortunately, it takes a long time to unlearn what has been learned, but we can do that. I believe education is the key. That society want to tell us that we can't contribute. Society want to tell us we can't work. Society want to tell us that all we are about is taking from the community. We should be warehoused. We should be institutionalized. And we got to change that mindset. And again, I say education is the key to that. And we got to challenge all of these misconceptions. I call it thinking, right? We believe a certain way. And that's because we've been taught that. And so that's the work to be done. That is the unfinished work to be done, is to change what we have been taught throughout history.
Theo, you're talking not just about attitudes of non-disabled people toward people with disabilities. You're talking about those attitudes that we have built into ourselves due to the society that we've grown up in.
Yes. It works both ways, because I bought into that just like you probably did, Lex, as I was growing up, and I realized, I wasn't the problem, that society was the problem. And I say this a lot. I think in my lifetime, at least I hope, that many of the physical barriers will be removed. But I know for a fact I will not see the societal attitudes, negative attitudes toward people with disabilities. That is a tougher fight. But I think we can move and go in the right direction when we challenge that. When everything that we do, we challenge that to prove people got it wrong.
Let me say, we've made progress there, because people with disability, the stories used to be in the family pages, in the good housekeeping pages. Now the stories are very often in the news pages. Yeah. So we made a little bit of progress.
Yeah.
Sean, reflecting back in the 70s, do you see these social activism movement coming forward in full dress now, or not?
John, you're muted.
I'm sorry. I'm people who know me know I'm an optimist, and I think we have made immense gains on dealing with these issues. I think part of the key to, I agree with Theo, education is key, but I think integration, community living is a key. Also, we're looking at people with disabilities are a quarter of our population. They are all of us. They are in every level of society. They are everywhere. It's an incredible potent force. We learned from 504 that people with disabilities can be a potent force when they work across disabilities and together, and can, in fact, move mountains, because 504 was that, the ADA was that, the ADA amendments were that. And when we talk about what our goals are, and we list all of those things, okay, all of those are our goals. There are millions of us. If we are working together, we can attack all of those problems, the problems of accessible, affordable, integrated housing, the problem of healthcare, which I hope the the HHS regulation is at least a step forward in getting health equity for people with disabilities. I mean, we're at the baby steps. We're at just getting accessible medical equipment, never mind changing the attitudes of doctors, which is where a lot of the bias comes in terms of if we can get rid of the notion of IQ testing for child welfare situations. We can get rid of the idea that a disabled person comes into a hospital and they want you to sign a DNR and they'll do anything they can to get you to do that. There are a lot of specifics, but I think we can attack all of those. There are enough of us. Individuals may have their own choice. It may be housing is the thing that you will do and pursue in your life. It may be healthcare. It may be community living. It may be getting a cadre of people who can provide personal care services so people can live independently with their own choice in the community. We can do all of those things. We just have to work together to do them.
Well, and the other point here I'd like to add to that is that if we're talking about a larger community than most of us think about. Yeah. We're talking 76 million baby boomers. These are people that were born post-World War II who are now, like me, a retirement age. And many people who are in that cadre are now disabled. And if they're not now, they will be tomorrow or the day after or the month after that. We are an ever-growing population, and we put all of our effort together, and we begin to educate each other. Then we can move beyond that and affect change in the whole society. Mary Lou, that was kind of the vision back in the 70s, wasn't it?
It certainly was the vision. But I wanted to just make a slightly different point, which goes to John's optimism, which is I'm often on the other side of that spectrum, which is, oh my God, it's really awful. What are we going to do about it? But I'm really very optimistic that the next generation and the generation behind them of advocates, of attorneys, of people with disabilities are more sophisticated than we ever were. They are very committed to the work. They're insightful, they're smart, they're committed, and they identify as proud people with disabilities. And I think that makes for a great platform for the future. And I'm optimistic that they are going to carry on this work. And I salute them and I appreciate them. And I'm very, very hopeful that the next 50 years will be as fruitful as the last.
Thank you, Mary Lou. Eric, do we have more questions?
Yes, we do. And we're not going to have time for them all. But this one is a really great one that feeds into exactly what you've all been talking about. And that's the community came together 50 years ago, when the sit-ins and people of all types of disabilities were coming together across the country. The community wants to know what can be done to increase cohesion among the disability groups. The question is sometimes the disability groups can feel divided, which doesn't allow them to amplify messaging or get through the elected leaders. So what can be done to build solidarity, between across ages, across disabilities to start moving the needle?
Well, I mean, that clearly speaks to the independent living movement, which actually started out to be a cross-disability movement. Our initial efforts were to engage people with all types of interest in disability. So, for example, Colleen talked about the bus situation in the 1970s. We put together a rally at our city hall, and while it was intended to benefit people who were primarily wheelchair users and people with mobility impairments, we were able to bring in the blind community, the deaf community, the community of people with intellectual disabilities, and we created a huge kind of mini moment where all the disability community was working together to gain one particular objective. And we did that over and over and over again, basically expanding the movement by including everyone in the action. And I think that's probably the challenge for the future, is to keep these groups from drifting back to their individual silos, but working together. That's the beauty of the Independent Living Center model. And it's really the aim of organizations like AAPD to do that. But we have to work together, and we have to reach across those groups, make friends with, get to know the leaders of the different disability groups, and work together in your own community. It all starts at home. So you got to know who your friends are, who your potential allies are, and who your colleagues are. And that's stretching. Colleen?
Yeah, I want to just, you talked about the local thing. Everything that is really local, politics are local. Bob Koff keeps telling us that. And I do think that that Nickel and AAPD are very strong leaders for this and can keep pushing that through their memberships. But I'd like to encourage people to consider peaceful demonstrations in their communities and marching and carrying signs. And here's why. I've ever since Justin called us on the 5th anniversary of the ADA to have ADA birthday parties, I began to answer his call by creating the Heartland Disability Rights March and Rally. And I invited people from Missouri and Illinois, all the local disability rights focus groups, and some who weren't focused on rights but had a disability focus. And when you come together like that and you do things that are fun and that are meaningful and have a point, and maybe you have an activity that you're organized around, whether it's writing letters to Congress or carrying signs or whatever, you build relationships among each other. Relationship building is a very, very important tool for understanding what each other's needs are and for learning how to work together on issues. And we go through phases of things like that. And maybe it doesn't have to be a disability rights march, although we've always had a great deal of fun doing them to celebrate the ADA birthdays, ADA anniversaries. But it did enable us as an independent living center to build relationships with people like Voc Rehab and the Council of the Blind and the Associations of the Deaf and the intellectual disability groups, and brought us together and enabled us to talk about common issues that would be the focus of our march. And so then you're helping each other to advance your voice, and you also get public attention that way. We have to be in the public. The other thing that I think is important is that we get on the news with our issues. Somebody said something about us not being in the Better Homes and Gardens, or whatever you said, Lex, not Better Homes and Gardens, but I mean, we need to be on CNN and MSNBC and Fox News, God forbid. We need to be, our issues need to be spoken about through the media, because that begins to change people's ideas and their ways of thinking about our issues.
Okay, thank you. I'm going to change up the format a little bit here. Erica, you mentioned there's a lot of people with questions. Let me say that if your question is not answered, I believe they'll be shared among us, and we'll be able to get back to you. I'm happy to do that myself in writing or otherwise. But for now, let's try to give as many questions as we can through, and those of us on the panel will try to do a 15 to 20 second quick answer to each one of these and get as much information out there as we can. Erica?
Lex, I think for some of the questions, we're going to have to individually email some of them. So I think that the best question to ask you right at this point is with the last 5-6 minutes we have, is what would be the key takeaway that you would want this audience to have, when we're looking at the 50th anniversary of the Rehab Act? From each one of you, what would you want people to walk away just remembering or knowing after this webinar?
Sounds good to me. Mary Lou, will you respond to that?
Well, I think in looking back over a 5-decade period, we've seen some extraordinary accomplishments. And the lesson I think that we should learn from that is that social change is possible. It is slow, it's hard, there's no easy formula. All of the kinds of suggestions and ideas and recollections that we've talked about today are the route to social change, but we can do it. We can do it as a group. We can do it at small scales in our community, in larger scales at the state or federal level. But I think we just have to maintain enough optimism to see that it's possible and to find the best avenues where we are and within our capacity to have a vision.
John, what will you add to that?
Yeah, I would reinforce it and say that if you look at what we talked about, what life was like in 1970s versus what it is now, 504 and the ADA and other things have brought about an amazing change. It's just the beginning of change. And I think the message we have, 504 is a tool and you can use it. It is available. People with disabilities can use it independently of the federal government. You have the power. 504 has shown that the disability community has incredible power to bring about social change, and it can be done. And so I think the next 50 years we have short-term goals now, but there are longer-term goals. And I think we haven't, Judy Heumann and I always talked about the invisibility of people with disabilities. How can 25% of the population be invisible in our country? But it is, and that's where, and I think that's where ableism comes in, not having people with disabilities in the forefront in a variety of places. And I think we have the tools to do it. People with disabilities have the power. The future is ours to make the change.
Colleen?
Justin told us to get involved in politics as if your life depends on it, and because it does. But that doesn't mean you have to be a senator or a congressman. You can be a board of aldermen. You can be a county council or city council. You can be a neighborhood captain. There's lots of things that you can do to make a difference in your community, but we do need to be seen.
Theo?
We learn from our past in order to make our future better. And so as we look back, we got to figure out what that one thing is. And we always had that one thing to galvanize us and bring us together and mobilize us to change the world. And I think Nickel is going to be working on that one thing. And I think it has a lot to do with asset limitations, right? Because it affects a lot of people. So stay tuned on that. And let's just, do the same thing that we did from the past, come together and change things.
Never give up. Never give up.
Yeah.
I would say after this program, call your local independent living center, find out when their next meeting is going to be, when their next public action is going to be. Call 6 of your friends, ask them to go and participate in that with you. Get involved. Anything you can do, but do something. Erica, we have any final questions, or should we turn it over to Allison now?
I think we can turn this over to our commissioner, but thank you all so much. You all did a wonderful job. I'm going to turn over to our commissioner, Jill Jacobs. She's a commissioner of the Administration on Disabilities, and she will give closing remarks for us today.
Thanks very much. And Eric,
thank you, panelists.
Commissioner Jacobs, we're glad to have you with us today.
Oh, thank you. I'm really pleased to be here. So good afternoon, everyone. It has been such a pleasure to be here for this, to participate in our 50th anniversary webinar in the Rehabilitation Act. And I'm so honored, people use that word all the time, but I really am honored to be here and be in the presence of leaders who helped us start this whole thing and help us get where we are, and who are committed enough to be here today, 50 years later, and communicate with us, interact with us, and talk to us about what matters, what happened, what can we do next. We heard from Alison Barkoff, who discussed the importance of the Rehab Act and that it authorized independent living programs, from John, who discussed the compelling story of advocacy and the evolution of the Rehab Act, and Lex, who discussed the need for the Rehab Act at the time of its passage and put it in historical context in that moment in time, and helped us understand what we meant as far as civil rights advocates and activists within the context of that time. We heard from Mary Lou, who presented very cool video, which encompassed the watershed moment of, action, of protest, of advocacy, and how people with disabilities oriented themselves in a very, in a way that included action and activity and community, that led to the implementation of the 504 regulations. And Colleen, who discussed what SILs did for people back then, how they came to be, and how 504 empowered people, gave us power, helped us believe, and helped to grow the Centers for Independent Living and the independent living movement. And then, of course, Theo, who discussed where we are right now. What does that look like for us right now? What do our mentors and what does history mean to us as we move forward? And so I want to thank all of you for your presentations. It's very compelling, very honest and real. And I appreciate them very much. They were comprehensive and really explained to us about the foundation of our movement and our present day implementation of the Rehabilitation Act and what we can maybe do moving forward. So I would say that that is a perfect lead in to discussing, in real life, every day beyond today, our bright future as people with disabilities, the very bright future of the independent living movement. You all demonstrated beautifully today about the independent living movement and the Rehab Act and how they are inextricably linked. And they are. They were then, as they have grown, as the IL movement and SILs have grown across the country, they have been, they are now, and they continue to be. It was the IL movement that drove the signing of the law. By the IL movement, I mean people with disabilities who believed in independence, in their right to live a life in the community as independently as they could. And the IL movement, not only drove the signing of that law and made that happen, but led the implementation of it. That law created Centers for Independent Living that the Administration on Disability has today, that we work with today. The Rehab Act is as powerful now as it was back then to people with disabilities, to the independent living movement. And I want to say to the broader community, to people who don't know anything about disability at all, about who we are, what we care about, it's important. And getting ourselves heard beyond our own bubble is incredibly valuable. And the Rehab Act is part of that. The independent living movement and the collaboration that has existed, cross disability collaboration with media, collaboration with, society, with lawmakers outside of our own realm has been invaluable. And at ACL, we support this concept, collaboration. And we know that the independent living movement and the Rehab Act are driving forces behind this kind of work. And we support, we're behind efforts to reinvigorate the implementation of the Rehab Act. The Centers for Independent Living are led by disabled people, and for disabled people. Nothing about us without us. We say that, but Centers for Independent Living reflect that. And the IL movement reflects that. And I would love to see us collaborate and come together more to reflect that as we move forward in our advocacy and activism and change making. Centers for Independent Living provide a broad array of services and supports that make community living possible for all types of disabilities. They employ a person-centered approach with services that are tailored to the needs and the preferences and the desires and aspirations and dreams of the person with a disability who receives those services. And they empower people with disabilities to make choices that promote their independence, their overall health, equity, and more to live and participate in the communities of their choosing. So increasingly, the independent living programs are collaborating with partners at federal, state, and local levels to streamline access to the services that are needed to support community living and to advocate for common goals and to leverage all available resources to move forward. For example, community living is not possible without affordable, accessible housing. But finding and securing and keeping accessible housing can feel really insurmountable. And it feels that way because it almost is. But I believe, and I think everyone here believes, we can surmount it, okay? We can beat that. And I know that because finding housing is so hard, we all know that, that means if you can't find housing, you can't get anything else. You can't have access to, now you don't have access to the services and supports you need to live in the community because you don't even have a roof over your head, an accessible roof over your head. So in every state and community, there's a number of entities and programs that help people access supportive housing services, but those systems are so siloed, they're confusing. There's so many barriers to get through. And it's important that we collaborate and coordinate around this. Here at ACL in 2021, we created something called the Housing and Services Resource Center, or HSRC, to foster that collaboration. It's led by ACL, and the HSRC connects the disability and aging networks, and I think that's important because Lex talked about people aging and how people who are aging are part of our community too, right? And there's a lot of people who are aging, baby boomers. And so the HSRC connects people with disabilities and aging networks, including Centers for Independent Living, to public housing authorities and housing providers, state Medicaid, disability, aging, and behavioral health agencies, homeless services organizations and networks, healthcare systems and providers, and tribal organizations and others. It connects us all to work together to help people with disabilities live successfully and stably in the community. By partnering with CILS, the people served by all of these systems can more easily access assistive technology, accessible transportation, home modifications, smart home solutions, and more to help them live independently in the community. So to me, the way I see it, CILS really are a true hub of life. They help us connect to everything that we need. And I would love to see the Centers for Independent Living, the IL movement, bridge more with the aging community and with elements of the disability community that maybe we kind of have some threads, but there's not as much collaboration as we could have, because that cross-disability collaboration is absolutely key to moving forward and getting where we need to go. Our independent living programs at ACL are also working with partners to improve employment opportunities. Earlier this year, we worked with, at ACL, we worked with Department of Education's RSA, Rehab Services Administration, and we announced a new partnership to integrate Centers for Independent Living into RSA's Pathways to Partnership program. So that focuses on building partnerships between the systems that support disabled youth, young people with disabilities, starting at age 10, I think, as they transition from school to adult life to increase their opportunities for competitive integrated employment. And those awards were just announced, almost $200 million. So what we did at ACL is we worked with Department of Ed and said, we want to make sure that these awards won't be granted to any state unless Centers for Independent Living are included. Those awards were just made. They were announced the other day, $200 million, and 20 Centers for Independent Living across the country got some of that money. That is a big thing. It's a big deal. And I hope that we're going to grow that. It's our intention, our desire, our intention, and it's our will to grow that so that more SILs will have access to those kinds of funds to change things, for you to train people, to train youth with disabilities so they can be employed. You know, we also established the Disability Employment Technical Assistance Center. I don't know if you all are familiar with DTAC, but it helps grantees, including SILs, to understand and support competitive integrated employment and economic stability for disabled people. Our independent living programs are supporting development of partnerships and collaborations within the independent living movement to ensure that all people with disabilities, disabled people of all ages, all types of disabilities from all races, ethnicities, nationalities, sexual orientations, and gender identities, different socioeconomic statuses, and more are included, and that no one is left behind. It's really what we believe in at ACL. And that's why ACL launched last year our Equity Center. It's a technical assistance center where people can call, they can learn, they can reach out, and our grantees can learn how to develop more equitable services for people with disabilities. The independent living movement will be more effective in its advocacy work, and the programs that empower people with disabilities to live the lives they really truly want, if we make sure that all kinds of people with disabilities are included. There's a long list of ACL programs and collaborations, advocacy elements that we are working on now, and I can't name them all, but together our collective efforts have brought about change and will bring about much more change. So I ask that we collaborate, we work together, we build a strong cross-disability movement. I love some of the suggestions about getting out there, you know, having events to bring us together and organize us. I would love to see us go old school. No offense to the folks here, I'm an old school person too. I'd love to see us go old school and do the kind of work that was done in 1973 that brought about the Rehab Act passage. Happy to see you all today, and I want to continue working with you all to support each other in creating paths to independence and dignity for all. Thanks, everybody.
Thank you so much to everyone for joining us today. A friendly reminder to our panel and our moderators to please save your chat if you received any direct messages. Thanks again, and you may now disconnect.